All right, so good afternoon, everyone. I am Andrea Barton-Reeves. I am the CEO of Connecticut's Paid Leave Authority, and I am really glad to be here this afternoon to give you this presentation on paid family and medical leave. I am uncharacteristically on my own this afternoon. We usually have one other team member, but everyone seems to have a conflict today, so I am here. In order for me to be able to answer your questions most effectively, I am going to ask that you use the Q&A feature to submit your questions rather than the chat. It is just really more challenging for us to make sure we answer all of the questions when you use the chat. So please use the Q&A. Also, I will answer all of the questions after the presentation, mostly because it's just me today. So it's going to be a little challenging to do it as we go along. And everyone will receive a copy of the slides. That's a common question that we get, and the answer is that we send them to everyone who has registered, whether they attend or not. And if I am joined by one of my colleagues, they will also put some links in the chat that can connect you to other parts of the website where you may be able to find some information. With that said, I'm going to share my screen, and we are going to go ahead and get started. And I also am going to apologize because I have a PDF form rather than a PowerPoint form. So I'll be scrolling through the slides rather than going one by one, which might make a few people dizzy. So I'll just apologize to you about that in advance. All right, so here we go. So this afternoon, we're going to talk about paid leave and how it applies to your business and offer some tools to HR professionals to try to make this just a bit easier for you. Just a little bit about me. I am the CEO of the Paid Leave Authority. I joined a little more than a year ago. I have a background in supporting people with intellectual disabilities, and I also have an insurance background, having spent almost a decade of my career at Chubb Insurance. And let's see. So let's go to our agenda. So today we will talk about the paid leave program and make a distinction between family and medical leave and Connecticut paid leave. We'll speak to how one might implement the Connecticut Paid Leave Act and the coordination of benefits between employer-provided benefits and what the Connecticut Paid Leave offers, implementing family and medical leave, because both the Family and Medical Leave Act and the Connecticut Paid Leave Law will go into effect starting next year. Some additional resources that are available to you on the website, and we'll have time for questions and answers. Okay. Let me talk a bit about the Paid Leave Authority. We are a 23-person organization that has 5 primary responsibilities. One of them is outreach and engagement, so we're always really happy to give these webinars. We've given about close to 40 since September. We find they're so helpful and people really respond to them well. We develop the policies and the procedures that are needed to run the paid leave program, and we also establish the trust fund contribution rate, which by statute cannot exceed 0.5%. We also receive all of those contributions into the paid leave trust fund. For those employers that choose to create their own version of the paid leave program by statute, they may do so by creating a private plan, which we will approve based upon application and then audit to make sure it's being run compliance with the statutory provisions. And finally, we are responsible for administering the claims for paid leave benefits, the applications of which will begin online starting on December 1st. Some key dates regarding the program: around this time last year, we had employers starting to register, and in January of this year, employers began to withhold the 0.5%. Those that were interested in a private plan did continue to, they submitted their applications on February of 2021 of this year. Payments have been coming in for the last 3 quarters. As I mentioned, starting next month, a mere 21 days from now, applications for paid leave benefits will begin. Those can be submitted online in several other ways, but the easiest way to do it is online, and then benefits will begin in January of 2022. So who is covered by the paid leave law? And also, this is important to know, as I mentioned earlier, the Family and Medical Leave Act for Connecticut is also changing. But what I'm going to speak to here today is this, at least on this slide, relates to covered workers. So those who are covered by the changing and new paid leave law are those employers that have 1 or more employees working in the state. and that includes not-for-profits and private sector employees that also have unionized workforces. If you are a sole proprietor or a self-employed individual, you may certainly opt into the program, but if you do so, you have to remain in for a minimum of 3 years. If you are a sole proprietor or self-employed and you have employees that are working for you, meaning you issue them a W-2, those employees are covered and must participate in the program, but you as a sole proprietor or self-employed person have the option as to whether or not you may do so. Those governmental entities and worker categories that are not covered include the federal government and the state of Connecticut, with the exception of some covered public employees, and the same is true for municipalities or local or regional boards of education. Covered public employees are those employees that belong to a collective bargaining unit and vote to participate in the plan. So as it relates to the state of Connecticut, a covered public employee belongs to a collective bargaining unit. They vote, they're in the plan, just the bargaining unit. The difference with the municipalities or the local or regional boards of education is when they vote as a collective bargaining unit to participate in the plan, everyone who works at the municipality or the local or regional board of education, whether they are unionized or not, are then participants in the paid leave program. Non-public elementary or secondary schools are exempt from paid leave. Other entities that may be exempt would include railroad workers, because they have actually their own subversion of a paid leave benefit. Employees who work for other states. We have some folks that live here that work for the University of California and University of Chicago and the like. Employees of sovereign nations, so those would be the tribes that own the major casinos in the state, and they are sovereign nations, those tribes, and they are exempt from the paid leave law. People who engage in interstate commerce, truckers, and don't pay tax in the state, and spouses of active military members who are still paying taxes in the state they consider their home state. Here's a slide that just specifically covers what I just described earlier, covered public employees, and mentions here what I had highlighted about unionized employees of municipalities and local or regional boards of education, collectively bargaining to be included, and then that collective bargaining decision is that only specific one is binding on the entire workforce, whether they're in the bargaining unit or not. The 0.5% that's been collected since January of this year is post-tax based on the employee's wages as calculated for FICA. And contributions are in fact capped at $142,800 with a maximum contribution of, you can see that $714 a year. That 0.5% of wages is collected by the employer and remitted to the paid leave authority. We validate that data with information that we have that's available to us from the Department of Labor and the Department of Revenue Services. The contributions are then deposited into the paid leave trust fund, and it is from that trust fund that we pay for benefits in the paid leave program starting in January. Let's now talk about the distinction between family and medical leave and Connecticut paid leave, and all of these acronyms and what they are. FMLA, as we currently refer to it and commonly refer to it, is the Family and Medical Leave Act, and there is both a federal and a state corollary to that law, and there actually has been since 1996. Both laws allow eligible employees to take job-protected time away from work, meaning that when the person is taking the leave for a qualifying reason, and they've worked a requisite number of hours, and for a requisite amount of time for that employer, they are allowed to take that time under FMLA and return to their job when that leave is complete. Right now, if a person takes FMLA, that leave is unpaid, and some employers do adopt policies that allow a person to have some form of income replacement. It could be short-term disability, long-term disability, pregnancy leave pay. Their employers offer a number of different options. But many employers do either require or permit their employees to use their earned accruals, whether it's sick or vacation or other PTO while they're out on leave. And they can still do that with some exceptions, and I will let you know what those are in just a moment, because the law is going to change significantly in 2022. You can see here from this slide that the current Family and Medical Leave Act in Connecticut applies to larger employers, those with 75 or more employees. And in order to qualify, those employees had to have worked for the employer for at least 12 months and 1,000 hours to enjoy that job protection that I spoke of earlier. Once they've done that, then they can qualify for up to 16 weeks of leave in a 24-month period. If taken fairly evenly, it'd be 8 and 8, and then 26 weeks of leave for military caregiver leave. And that would be a family member who's caring for someone who's either being deployed overseas or who's been injured during active duty. And as of today, an employer can require an employee to exhaust all of their accrued time to pay for the time that they're away on FMLA to cover their lost wages. Starting next year, for FMLA, this changes considerably. It now applies to employers with one or more employees, and there will be no more hours worked requirement, and the job protection will attach after 3 months. Now, instead of 16 weeks in a 24-month period, there's 12 weeks in a 12-month period. The length of time for military caregiver leave remains the same, but an additional 2 weeks might be available if a person is incapacitated during their pregnancy. Now, it's important to note here, it's not due to pregnancy, but during pregnancy. The incapacitation can be related to pregnancy or not. But that's not really the relevant factor. The factor is whether the incapacitation happens while the person is pregnant. And if it does, then they may be eligible for an additional 2 weeks of leave for up to 14 weeks. Finally, although the employer can still require the employees to use their accrued time off, they have to allow the employee to keep up to 2 weeks of accrued PTO. We often get the question as to whether or not the PTO has to be vacation or sick for those employers that use time in different categories. What I can tell you is that the reason that this particular provision of the law came about is because there was quite a bit of testimony provided when the law was being considered that allowed people to tell their stories of how they would exhaust their PTO to cover their FMLA time away and then be unable to do things like go to their children's graduations or long planned dream family vacations and the like, and miss weddings. So that was really the purpose behind that. So when you're deciding which buckets of leave the person should be able to keep the 2 weeks from, we're just encouraging employers to keep that in mind. CTPL, as you often hear us refer to, it stands for a few things. We use it to refer to both the statute, the program, as well as the agency itself. It's important to note that Connecticut paid leave only offers income replacement, and it's only available in Connecticut, although some of our neighboring states, Rhode Island, New Jersey, New York, and Massachusetts also have their own form of paid family and medical leave benefit as well. It does not provide the job protected leave that I spoke of when I spoke about FMLA. We also refer to it as PFML or paid family and medical leave. The reasons that you can use Connecticut family and medical leave and receive paid leave benefits are these. You can use it to receive treatment for your own serious health condition or that of a family member. That's also known as caregiver leave. And they can be used to become an organ or a bone marrow donor as well. For bonding leave, to bond with a newborn or a child that's new to your family through adoption or foster care. To care for a family member injured during active duty, known as military caregiver leave, and that is a leave that you take to care for the family member. It is not a leave that attaches to the person who was in service to our country. The same is true for the qualifying exigency leave. That leave is the leave that you take to support someone who is going to be deployed overseas. And what is actually specific to Connecticut is this last leave, which is the family violence leave. That is available for people who are impacted by family violence who would usually take leave under the state's Family Violence Leave Act, which allows up to 12 days of unpaid leave to address issues that arise from family violence, which might be finding shelter, attending court hearings, looking for a behavioral health provider, as an example. That leave is available today, but it's unpaid. This will allow that person to seek up to 12 days of paid leave for those reasons. Then let's talk a bit about caregiver leave. You've heard me refer to caregivers under the caregiver leave in the previous slide and for military leave and the like. So what I'm referring to is a change that will come starting next year. Currently, you can only take caregiver leave for a parent, a spouse, or a son or daughter under 18. The law will change starting next year, where caregiver leave will be available for all of these categories that you can see here, which is expansive, particularly now allowing for us to care for a son or daughter of any age, when the previous restriction was the child had to be under 18, or if they were over 18, they had to have a disability. The most significant change here is the related by affinity. So not only can caregiver leave be taken with appropriate proof for all of these categories, it can also be taken for someone who is like family to you, meeting one of these categories of family with appropriate documentation. So related by affinity does mean a person who has a significant personal bond with the employee that's like one of these relationships without having the biological or legal relationship that goes with it. So it's someone you may have been living with for any number of years, and you're beneficiaries on one another's life insurance, you've raised children together, you own property together. That person may be a spouse to you, and with appropriate documentation, like I mentioned, maybe it's a deed to the house, or it's the beneficiary statement for your life insurance and the like, then you would be able to show that person is like a spouse to you and be able to take leave to care for them. It is the Department of Labor that makes the determination as to what the attestation or proof will be to show that a relation by affinity exists. And they are almost done defining that, and we are hoping to have that very soon. A bit about the eligibility requirements. I spoke earlier of federal FMLA, that remains unchanged. In order to qualify for federal FMLA job protected leave, same thing, get your job back, those qualifications remain: having to work with the employer for 12 months and 1,250 hours in the year before you take the leave. Mentioned earlier, no hours worked requirement, 3 months with the employer for Connecticut FMLA job protected leave starting next year. The income replacement benefits, excuse me, are these. In order to qualify for income replacement benefits in Connecticut, you do have to earn at least $2,325 in the highest earning quarter in what we consider that base period. And then you have to be currently employed, or you were employed and working in the state in the past 12 weeks before you apply. If you're a sole proprietor or a self-employed individual, there is a residency requirement that does not apply to everybody else. It's just these two categories, and they've opted to participate in the paid leave program. A summary of the entitlements. We spoke of these earlier. Up to 12 weeks in a 12-month period may be taken under the federal FMLA job protected leave, and the 26 weeks of caregiver leave for military caregiver leave remains. 12 weeks for a 12-month period. So it almost mirrors the federal FMLA and the 26 weeks for caregiver. We spoke about the 12 days for the family violence leave and the additional 2 weeks for incapacitation during pregnancy. All of the reasons that apply to job protected leave are also the same reason you can seek income replacement under FMLA starting next year. But when a person takes family and medical leave, or they're looking just to take job protected leave from their place of employment for any reason, there are also a number of laws that may apply, and that's what this slide is attempting to explain. As we noted earlier, federal FMLA remains in place and probably will, and we're not really sure what's happening with paid family and medical leave on the federal level. We'll continue to watch that. Then adding to the laws that provide job protected leave is our Connecticut FMLA, Workers' Compensation, the Americans with Disabilities Act, the Pregnancy Disability Act, and the Connecticut Fair Employment Practices Act, also known as CFEPA, are also still viable job protected leave laws in the state. For those laws that provide income replacement, workers' compensation not only provides job protected leave, but as many employers know, it also offers monetary compensation and coverage for medical expenses, but you may not collect workers' compensation and Connecticut paid leave benefits at the same time. And the same is true for unemployment benefits. You may not receive unemployment benefits and Connecticut paid leave benefits at the same time. Let's talk a bit about how we might implement the Paid Leave Act. I will review contributions very briefly because most businesses have been making them since January, so we're at almost the year mark. Workers, we know, contribute 0.5%. Employers are responsible for collecting that and remitting it. At the authority, we receive those, we reconcile them, we process over and underpayments. We have the statutory right to impose penalties for noncompliance, which we have not done in this calendar year because we recognize how challenging it's been. But that very well may be the case come the next calendar year because we've had 123,000 employers register with the Paid Leave Authority. So we're very grateful for the compliance and need to encourage others to do the same. If you have not been taking the deductions or you believe you haven't been taking enough, and we will let you know that, then it is the Connecticut Department of Labor that can determine whether or not you can use a catch-up period to retroactively take more wages up to a 1.5% in total in order to make up the difference if deductions hadn't started in January or the deductions were not taken at the amount that they should have been to meet the contribution rate that should have been met at this point in time. And special permission has to be had from the Department of Labor. Claims, which start next month. Here is a summary of what has to happen. The worker is responsible for applying for the benefit from the Paid Leave Authority, not the employer. They will have to create an account online and provide us with the appropriate documentation, give us any information about absences and other sources of income, and then tell you as the employer about the claim. The employer will be asked to submit an employment verification form, which will ask a number of questions, not the least of which is, does the person actually work there? How much do they make? Do they have any other kind of employment benefit that might impact the amount of money that they'll get? Employers will also be asked to create policies if they don't already have them, and also to provide any information to the employee about what they will be required to do and to refrain from discriminating against them for exercising their right to use their paid leave benefit. At the authority, along with AFLAC, we take responsibility for all of the functions from determining eligibility to processing the claims to imposing penalties if we find that there is fraud or misrepresentation that is willful. The Connecticut Department of Labor is responsible for hearing any appeals related to denials of claims and any penalties that the Paid Leave Authority may impose because of fraud or willful misrepresentation. That the DOL hears claims for both the public and the private plan. Here's a bit more about how the income replacement process will work. As I mentioned earlier, the worker will submit a claim. They may call AFLAC, although we are really encouraging people to go directly to the website, ctpl.org, create an account, submit a claim, and upload all of their documents to the extent that they can. It is the fastest and easiest way to do that. They will submit their application. There's a checklist in their welcome page that will tell them everything they need to include, including some of the things that you see listed here. AFLAC, along with the Paid Leave Authority, determines eligibility, including the validation of the worker, whether they actually work for a company that is participating in the plan. And if there is some determination made that the worker isn't eligible, AFLAC will let them know, and then they give them the right to have a reconsideration of that decision. If the claim is approved, there's supporting documentation. If it's denied, again, there's a right for reconsideration. AFLAC essentially manages this whole process with oversight from the Paid Leave Authority. If it's approved, they calculate the benefit payment and they take into consideration other types of data if that's applicable, and then issues benefit payments, always on a Tuesday, always 2 weeks in arrears. The worker has the responsibility of notifying AFLAC of any changes, meaning if there's any change to the length, the type, or duration of their leave. If they're taking intermittent leave, however, they're going to be required to report to AFLAC and to the authority more frequently, as those leaves tend to fluctuate more often than what we call block leave, which are leaves in weeks and days of time. Now, the person will receive a certain amount of benefit payment based on how much they make. If they're making less than or equal to the minimum wage multiplied by 40, they essentially get 95% of their base weekly earnings. If they make more than that, then they get 95% of 40 times the minimum wage plus the difference between what that number is and what they make, but under no circumstances can anyone make more or receive more in benefit than $780 a week in income replacement. Here's an example of how that might be applicable to someone making minimum wage and someone making just a bit more than that. Worker A, as you can see, receives minimum wage or earns minimum wage. So their calculation is pretty simple. They make 95% of that, which is $494 a week. Worker B, however, makes a bit more. So their base weekly earning number is different than the base weekly earnings of the minimum wage person. But we start out by 40 times the minimum wage. And then 60% of the difference between what worker B makes, excuse me, and what that base weekly earning is at the minimum wage. In this example, it's $12. So they make $506. They receive that in paid leave benefits. So what happens when an employer or the employee has some employer provided paid time off? Well, it really depends on how much it is and what access the worker has to it and how much of their time or wages are covered by that PTO. On the far left is really a baseline reminding employers that they can permit or require their employees to use the PTO, but they have to be able to allow them to keep that 2 week that they're entitled to. Now, if the worker has no PTO to use for FMLA, then they receive the full amount of their CTPL benefit for the entire time that they're out. If they have enough PTO to cover the leave, then that's equal to their regular pay, and this is true for some employees, then there is no CTPL benefit available to that worker. We often get the question, well, if that's the case, then why is the worker contributing to the paid leave program? Because workers change jobs. And while that might be a benefit that's available to them in one job, they may move to another that might be smaller or larger or doesn't necessarily have that same benefit, and they may avail themselves of that benefit at another employer. So that's why even if they're working at their current employer and they don't have and they have a very generous policy and they're not availing themselves of the benefit, they may do so in the future. So then the next category is that category of worker that has PTO to cover part of their leave, meaning is that their regular pay. So let's say they have 5 weeks of accrued PTO. They need to take 3 weeks of time off for their own serious health condition. They're allowed to keep 2 weeks. So now they're going to use 3 weeks of their time and a week of PTO, 2 weeks of their time and a week, I think I said that backwards, and a week of paid time off in the paid leave authority. But what happens though is that the CTPL benefit starts after the employee has exhausted their available PTO minus the 2 weeks that they're entitled to keep. Now, let's say that the worker does have PTO, but it will only pay for part of their benefit. Then what we do is we have the employee come to the paid leave authority to apply for their benefit. We pay pursuant to the law, and then the employee goes back to the employer to coordinate any benefits that might make up the wage difference. Now, I know that this is really significant for those of you that had short-term disability policies. I do not have all of those answers, but I can tell you that the employee by statute is not to get more than 100% of their regular pay, which can be challenging when you have fixed percentages for short-term disability policies. And we are going to actually put together a bit of a slide and some information that we think may be helpful to employers as they're navigating that portion of the law. What do your workers need to know about all of this? As they come in and ask for a family and medical leave, and then they ask to have access, or they tell you that they're going to access their paid leave benefit through the authority, they should really know whether you require or permit them to use their PTO or their sick bank or whatever other benefit they have while they're away, and what the rules are about how they can use them. And again, if there's a short-term disability policy, they should be very conversant or at least familiar with how the policy works, because that is going to determine how they will apply for their benefit and actually whether it will reduce any amount that we pay versus any PTO they might use or any other benefits they may have access to. All right. I will talk a bit about family and medical leave only because these two laws, the paid leave law and the FMLA, are so linked but the FMLA is really the purview of the Department of Labor. We're just offering this so that there could be some clarity around how this process works. With respect to the Paid Leave Authority, we don't have any official responsibilities when it comes to administering FMLA, but as an overview, it is the worker's responsibility to let the employer know that they need to take time off for FMLA and to submit their application, to give the employer any documentation that you might need, and to comply with all the attendance policies. Employers, especially those, that may have had 49 or fewer employees, may not be familiar with FMLA, but you will have to have some leave policies, including rules about how you use PTO. There are poster requirements, and it's important to process leave requests in a timely manner and to monitor the leave so that the person isn't using more than their 12 weeks in a 12-month period. Managing their return to work is also the responsibility of the employer, as well as refraining from discrimination or retaliation against the worker for using FMLA. Now, most people will say, we don't discriminate. That's not what we do. That's not who we are. That's not how it works. But it can happen so inadvertently. And here's an example. A person can go out on FMLA, and between short-term PTO, paid leave benefit, they're at 100%, they're out, they're done. And you find, wow, I've divided their responsibilities among 2 or 3 other people. This is working well. I'm not really sure that Bobby needs to come back. But the fact is that if they don't come back, that is a form of discrimination and retaliation. It may be a perfectly reasonable conclusion to come to based on how your business is running, but is a classic reason why people end up prevailing in FMLA discrimination and retaliation claims. It happens more often than you think. It is the Department of Labor that's responsible for managing FMLA, providing guidance to workers and employers, and they are also the entity that governs any oversight of any complaints regarding the denial of FMLA claims and claims of retaliation or discrimination. A little bit more about how job protected leave would work. The worker comes in and says, I need to take time off from work. They do not have to say, I'm taking FMLA. They can say, I'm having major surgery, or my sister is having major surgery and I need to be there for her because I'm her caregiver. That would be something that they would be able to give you 30 days of advance notice. They don't have to say it's FMLA. We know it's caregiver leave, so it's one of the reasons that leave is available under the statute. If it's an emergency or something that has become emergent over time, then they do have to let you know as soon as practicable. The first thing the employer does is sort of run through that list of eligible reasons why a person can take leave, and then say to the worker, I think you probably fall within the category, but I need you to bring me some more information. And you have 5 days from the time they come in and say, I need to take leave, to tell them, we think you fall into the category of leave that's covered under FMLA, but here is the other documentation I need from you. And that list should always be available to them, and that notice should be provided in writing. It's not the same thing as the leave approval. It's putting them on notice that they might be eligible, but you need more information. They have 15 days to get that information to you. If they need more time, you should provide them with more time. Sometimes most employers give up to 30 days. That if it's really an extenuating circumstance, some can exceed it to 45, can extend it to 45. But I can also tell you that when sometimes these issues are litigated, it doesn't fare well for employers who are really rigid around these timeframes, but 30 days is about the right amount of time, especially since it can be hard to get some documentation like military records and medical certifications from physicians and other healthcare providers who are pretty much inundated. Now, once they come back in with this information, the employer has 5 days to look at everything and get back to the worker and say, you've gotten me everything I need. It looks like you have a qualifying reason. I am approving your FMLA. And then you need to tell them how they need to use it, where they need to report, how they need to report, whether they're going to need a fitness for duty, how they have to call in, all of those things. And then you can also talk to them about how they're going to get paid while they're out, which can include the PTO, paid leave, short-term disability, and the like. The worker is responsible for reporting to the employer when they actually take leave. That means when they call out and they say, I'm not coming in, you as the employer can say, why are you not coming in? Is it FMLA? And that way you can track to make sure they're not exceeding the 12 weeks. When the worker has met the amount of leave that they're taking at that particular time, they're entitled to return to their job. This is Connecticut law with the same terms and conditions. And an employer can't insist that they be 100% ready to come back or completely recovered. That is considered a form of discrimination and retaliation, because there might be some reasonable accommodations that you can make under the Americans with Disabilities Act or the Connecticut Fair Employment Practices Act that would allow the person to return to work with a reasonable accommodation. And there's lots of information that you can learn about that, and that's a webinar for another time. No one's saying this is easy. There are lots of complicating factors around FMLA. That includes managing worker absences. Honestly, there are some managers that will embrace this less willingly than others, and that's something else that needs to be managed. Intermittent leave, where the person may take the leave because they have a chronic condition, let's say like migraines, for example, or seizures, and they have to take time off that might be unforeseen. Those are very challenging to manage. And of course, a person might be eligible for a federal FMLA and then state FMLA at the same time. Sometimes you can run them at the same time, sometimes you can't. The other thing is that there will be workers who will come in and say, I don't want my leave to be designated as FMLA because they don't want to exhaust their FMLA, nor do they want to dip into their paid leave eligibility. It is not the worker's choice. In every circumstance, the employer has the right and also the responsibility to designate that time off as FMLA. Because of the job protection, it's critical to do so because it protects you and the employee should there be any disagreement or any concern about why the leave is being taken. I know I've talked about a lot of things today. It's pretty complex stuff, but there are a number of additional resources that are available to you, and they are here. There is this employer toolkit. There's also a tool known as and Amber, maybe I see you're back on. If you have a chance, if you could pull up the HR toolkit for me while I go through this, so maybe we could just look at that briefly. The employee rights poster, the employee wrap card, which is a smaller version of the poster that outlines all of the nuts and bolts of what the paid leave program is and what it offers. The fact sheet is more in a question and answer form because some people just understand information differently. The employer toolkit has everything I just described, but the specifics of how you manage the paid leave is going to be in the HR, the Human Resources Toolkit. If you have not been withholding, as I said, discussion between you and the DOL, but we do have this employee paycheck mailer that you can include if you're going to start now. I really want to thank you for being here today. We do have about 20 minutes for questions, which is great. We do not have a call center because they are a very expensive proposition. And all of the money that as much money as we get, we want to be able to use for benefit payments. We do have a contact us feature on our website, and there is a team of people who are responsible for referring and responding to those questions when they come in. And if you need a call back, you can indicate that when you submit your question. We also have a lot of frequently asked questions. There's over 200 of them on the website and some videos that might be helpful to you. So thank you again. Here's our website, ctpleave.org. And I appreciate the time that you spent with us this afternoon. I'm back online.
Thank you, Andrea. I do have that HR toolkit pulled up. Do you want me to go ahead and share my screen?
Yes, let's take just a minute to take a look at that and share your screen. Thank you.
Here we go.
All righty. All right. Let's take a look at, maybe we can go to the page that outlines the workflow. So you can see here that it has all of the things I spoke about, who's covered, how that happens. So here's what happens when a person is applying for leave. What page is this on, Amber? Is this 5?
It says 5.
5, okay. Yes, so here's what you can, and we design this in a way that you can print it, take just that single page, put it somewhere where it might be, you can save it and put it somewhere where it might be helpful to you. It is the worker's responsibility. They apply to the paid leave. They get the employment verification form. The employer fills it out and returns it to FLAC. Thank you. We validate their eligibility. We calculate it. We pay the benefit. So if anyone comes to you and asks you, how does it work? It's on page 5. Page 6 we thought would be another helpful piece of information. It is all of the ways that a person can apply for their paid leave benefit all on one page. And you can see there are 5 ways in which you can do that. That email address at ctpfl@aflac.com is also available to employers that have a specific question about a claim that their employee may have filed. It is not to provide a status of the claim because that is between the employee and AFLAC. But if there's other information you might want to ask, if there's specific additional information you want to provide, you can use that aflac.com email address for that purpose. That was it that I wanted to share from that. And just, if you wouldn't mind dropping the link to that in the chat, Amber, that would be great.
Sure.
Thank you. All right, now let's take a look at some of the questions we have here to see what we can answer. All right, can you define incapacitation in this block? Oh my goodness, I wish I could. There's no statutory definition of incapacitation, but generally the way that it's been described to us by the Department of Labor is if it adds some level of complication to the person's pregnancy as determined by their doctor. But again, it doesn't have to be necessarily related to their pregnancy. If a person has preeclampsia, as an example, that could be considered a complication significant enough that it may cause incapacitation, and an additional 2 weeks might be available. Bed rest is another example. If the person, contracts a terrible, terrible cold, that would not necessarily be incapacitation. So I couldn't give you a more specific definition because it really is case specific, but it really has to be so significant that it would cause that person's healthcare provider to exercise additional caution and have them be out for an additional 2 weeks. Okay. So the next question is, I need my glasses. This is just that
You
time
at the
of
top or at the bottom, Andrea? I'm just trying to follow you.
I think I'm at the very top.
Okay.
Right, with the question that begins, can you define incapacitation in this block? Then the second question is, keeping accrued time off for employers with, oh yes, we get this question often, with unlimited time off, this doesn't apply. That is correct. So we have more employers than I thought, the state that actually offer unlimited time off. Some have changed their policies and others have just simply said, we're not changing our policy. You can continue to take the time off as you see fit. It really was designed for those employers that don't have, and they have a more traditional PTO or vacation sick time. As long as a person has this, the bottom line is this: as long as a person has 2 weeks that they can use for their own vacation after they've exhausted their 12 weeks of their family and medical leave, then that's fine. That's what we mean by the 2 weeks of PTO. Can we provide a link to the bonding leave form? There is not a specific form for bonding leave. There is a form for the employer to complete. When a person is applying for their benefit, they will receive a welcome packet that has a checklist of all of the documentation they need to get, and that medical certification may include, or any other certification they get may include the fact that they're taking time for bonding leave, okay? What do we consider appropriate documentation under the close or the related by affinity? That is a question for the Department of Labor. They have suggested that they will either have a statement or they will have some examples of what they would consider appropriate documentation. So I am not going to speak for them because that's just that's their purview, but that's what they're telling us right now, and they're actually working to finalize that as we speak. So the next question is, can two family members working for the same employer take leave at the same time to care for the same family member? Yes, they can. They're considered separate employees, both paying into the fund. They can absolutely take time off at the same time to take care of the same family member. And because, remember, family and medical leave is an entitlement, you can't deny the person time off because it causes and in some cases, I realize this, especially for small employers, it can be a significant hardship. There is no hardship exception in this law. There was a hardship exception under the Family First Coronavirus Response Act, known as FCRA. Some people knew it that way during COVID. But this law does not have a hardship provision. So you can't tell people that they're not permitted to take time off because more than one person is going out at a time. So When can employees start to submit claims? Yes, employees can start to submit claims on December 1. We're really strongly encouraging people to submit their claims online. And we're actually asking you to do it early and not wait until January 1. Okay. So if employees start to leave in December of 2020, may they still submit a claim for January 2021? Absolutely. You most certainly can. You most certainly can. Yes. Oh, thank you, Jennifer. It's my pleasure to present. Are employers required to track CTPL usage or just FMLA? You are required to track FMLA, but I can tell you that they will probably track pretty closely. You are not required to track CTPL usage. That is our responsibility. And actually that's being done by AFLAC. So you're just checking and tracking the FMLA, CT-FMLA usage. What does the employee provide to verify their earnings? They will provide a couple of things. They will provide any information if they have pay stubs or any other kind of statement of their earnings. But we have access to the Department of Labor data to verify earnings as well. So even if they came with documentation that and I've heard this from some employers that may look less than credible, I'll just use that as an example, we can still verify that with wages that have been reported by their employer or employers from the Department of Labor. Are there poster requirements? There are poster requirements. They are inexplicably only applicable starting in July of next year. I don't know why. I don't know why. So what I would say to you is when I showed you that employee rights poster, a lot of employers are just downloading that and putting that up. We will modify that in the next, probably the first quarter of 2022 to say things like, you should tell your employees that this is available to them. There are requirements. I don't know why it's only available in the middle of next year, but we have that for you if you want to use it now. Okay. If an employer has a disability benefit, after, how do they know? You know, because we're going to tell you. You're going to receive an email. That's why it's so important that when you fill out that employer verification form, we have at least one, if not two contacts that we can send the benefit notice to. So you will know exactly how much they're getting, and that's how you'll know that you can avoid overpayment. Let's see. I don't quite, I think, understand. Amber, do we have the ability to take people off mute or no?
Let me see.
Because I'd like to hear Margarita's question live. And while you're doing that, I'll answer the next question. No, you cannot force employees to take. This is an interesting question. We get this quite often, and I understand why employers want to compel people to take CTPL. You cannot compel them to take it. It is a benefit that they can avail themselves of if they would like to. But some employers are redesigning their benefit packages so that there's an incentive to go to the paid leave authority. I'll define it that way.
Thank you. But Margarita, no, you've been unmuted. Would you mind asking your question live?
Hi, Margarita. Thank you for taking, yes, I just didn't quite understand. I want to make sure I get the question in full context.
So I know that back last year, we notified all of our employees that they were going to be having to pay this premium. It's going to be deducted. What is our employer requirement now to tell them that this leave is now available to them as of 1/1/2022? Do we have a requirement as an employer, or do we just take it as each employee requesting leave, we provide them the information?
That's a great question. Thank you. So I'm so glad you came off mute because that's a completely different context than when I understood it. There is no requirement right now, and that's sort of related to the question that was asked earlier about what are employer notification requirements and obligations under the statute. It actually doesn't, those obligations don't trigger until July of 2022. And again, I don't have an explanation as to why that's the case. We, however, are strongly encouraging employers to let their employees know that this is available. And we're trying to do our part by having these webinars, and you'll see things on buses and trains, and in newspapers, you'll just see it everywhere and on radio so that they know that it's available. It's one of the things that you're going to want to talk about when a person comes in and applies for FMLA, and you're going to say, in order for you to get paid while you're out, you have PTO, short-term disability, you can apply to the paid leave authority, you can, use whatever other kind of benefit we might have. So it's another tool that might be available to them, but until July, you don't have an obligation to let them know that it exists. But I can tell you from the volume of requests that we're getting in our contact center, there's a lot of people that know. And I'm sure more will continue to.
Well, could I ask you one more question?
Sure.
So you talked about the employers having programs that pay wages. So for instance, we have a short-term disability pay program. It doesn't pay wages until the 8th day of disability, but then we pay 100% for 6 weeks. So would that first waiting period week, they'd be eligible under you, but then after that, they wouldn't be because we're paying 100% of their wages. Am I understanding that correctly?
You are absolutely correct, especially since the paid leave program doesn't have a waiting period in and of itself. A person is immediately eligible. So you're right. The only concern that might arise there is because of the timing, and because we pay 2 weeks in arrears, a person may actually end up inadvertently getting a benefit payment because of our 2-week delay while they overlap with your 6 weeks. And we would consider that an overpayment and may ask them to either pay that back, or if they're going to take leave later on in the year, we would apply that to that leave that they would take later on. But you're absolutely right. That's how it would work.
All righty. And then I know that you don't have any authority over the CTFMLA, but currently the forms they have not been updated. And I just want to make sure it's clear that federal FMLA, the eligible family members are different from the CT family members. So an employee could technically take CTFMLA for a grandparent and then 6 months later take federal FMLA for a child.
You're absolutely right.
Okay. Thank you.
You're very welcome. Yes, I understand. All right. Are there specific form and notices? I think I answered that, Jennifer. And if I haven't, then let me know. So no, there aren't yet, and there won't be until July, and we will be providing you with those forms. But in the meantime, as I said, you can go onto the website and use that employee rights poster, as we call it. It's really sort of the long form, and that should suffice for notice and information until we can get you something. Employers will, in fact, be notified if a claim is approved or denied, and that is why that email is the correct email address is so important for us to have, because that's the way we're going to notify you. Employees can submit claims starting on December 1st. They should definitely do it online. I think I'd answer that one, so I apologize for that. How will employers receive the verification form? There's a couple of ways. We're going to put it on our website, and it comes in the welcome packet that employees will be receiving. So they'll either give it to you or you can download it. And I think it's going up on the site this week or the early part of next week. Okay. So the next one, is caregiver leave a separate leave, or does it fall under CTFMLA? Well, Jennifer, can we get Jennifer off mute so I can understand if there's a different kind of caregiver leave she's referring to?
Sure.
Okay, thank you.
Hi, Jennifer.
Can you hear me?
I can, yes.
Okay. All right. So I'm looking at the presentation. And on one of the slides, it says caregiver leave.
Yes.
Under the Connecticut laws. Parent, spouse, son or daughter, sibling, grandparent, grandchild, an individual related to the employee. So I'm just wondering what that caregiver leave is.
Yeah, it's not a separate leave. What that slide was intended to do is to give clear, and clearly it failed, was to give clear definition as to who would fall under the category of a person that you would be able to take leave for in order to provide care. So that, let's say you want to distinguish the parent, spouse, child from your neighbor or your best friend, right? Or the person who happens to work, your coworker who you happen to work next to for the last 6 months, who may very well need caregiver leave, but they're not in the category of qualified of people who are covered under the family and medical leave law for whom you can take leave in order to provide care. So it's not separate. It's just meant to more clearly define those categories of people for whom leave can be taken to provide caregiver leave. Okay. Jennifer?
Yes, I'm all set. Thank you.
Do that? Okay. All right. Let's see. I think
that's
we
it.
have, yeah, I think we answered all of the questions. So let me just see if there's any others that are open that I've missed, but I don't.
I have to say, this group has been fantastic. You are possibly the first group in history to not ask a single question using the chat. So thank you.
That is certainly worthy of a prize. Yeah,
All
we try
right,
to
I think
flip back
that's
and forth.
everything.
It is. I want to give you just a little bit of time back and really thank you for taking the time this afternoon to join us for this webinar. We hope you found it informative. Again, you will get a copy of the slides and a copy of and a link to the recording, and the recording all goes up on our website and it is also on our YouTube channel should you need to revisit the information at any time, and feel free to share it. It's all public. We really want as many people to be as informed as possible. So thank you very much. Thank you, Amber. And we'll see everyone next time. Have a good afternoon.
Thank you. Bye-bye.
Right. Bye.